Hello, welcome to my podcast. I'm Catherine Reyes, and I will be interviewing my aunt, my tia Carolina, who I will be referring to her as for the duration of the podcast. Today, I'm excited to learn about everything there is to know about medicine in terms of dentistry, which we don't talk about all that much. And so, Tia, if you could introduce yourself.
Hello, everyone. Hello, Catherine. I am Carolina Rivera. I am a dental assistant and been practicing for over 21 years now.
Fabulous. That's you have so much experience, which is why I was so excited to talk to you about it, especially in dentistry, because we really don't talk about dental health as much as we should in regards to literal medicine, because they're hand in hand. So
Yeah,
my first,
definitely.
my
I feel
first,
between dental care and eye care, people, they kind of underrate it, you know. Everybody just thinks of doctors in terms of internal medicine.
Now, honestly, as someone who, needed braces and also has glasses and everything, I definitely recognize them more, but sometimes they get sort of thrown under the table, but that's what we're here for.
Agreed.
So I'd like to start with, what does a typical day look like for you?
Well, on a typical day, I start my morning by reviewing my schedule, and, getting my equipment ready. I work for a general practitioner, so we do basically a little bit of everything. We do from fillings and crowns, extractions, root canals. We see children sometime, as well as we have a patient right now that just came in. She was like 102.
Wow.
Getting dental work, yes. And as well as emergencies, which is one of the things that I wanted to go into as to why they become emergencies, whether it's neglect or just putting it off, procrastination. Sometimes it's fear of coming into a dental office, and a lot of times also it's finances that keeps you away. And that's when a lot of patients end up needing emergency visits. They have infections and things of that nature. So when I go into my day, I start just seeing what it is that we have to do, so I'll know how to go and prepare my operatories and proceed with those procedures.
That's very thorough. That's a lot of stuff that you guys do, and I like that you mentioned the financial aspect of it, because that is something that I tend to focus on, because healthcare is a privilege, and a lot of the time, because we neglect dental care in addition to our physical health, we often forget that dental care is important, but also it is expensive, and that is the reason that people do put it off so often, which is quite unfortunate. And so, on that note, on your typical day, what are things looking like now because of COVID-19?
I'll be honest, the first 2 to 3 months, it was quite stressful. It was emotionally, mentally, and physically draining for me. I'd go in almost like an hour early to work to prepare myself and gown up and everything, and at the end of the day I'd stay almost another hour trying to make sure everything's ready for the next day. We started seeing less patients to allow more time between patients to air out the rooms, disinfect and everything. And though I've had a couple of patients ask me, what are you doing differently? We're like, as far as disinfecting, I'm not doing that much different, in the sense that I was already doing that from the beginning. People fail to, they're always asking now, are you disinfecting? I was like, I was doing this disinfection method from before. I think if anything, we're using more supplies. We're covering more things with plastic. We're throwing away a lot more plastic. It's that give and take where we do need to cover up everything and use all this PPE, but then I feel horrible for the environment because we are using so much plastic and throwing that away. And, we're trying to be in the middle of so many battles and trying to be winners at it. But it's very difficult because we're not doing very well in winning this battle with COVID. We're not doing well with global warming. And, with the added materials we're using, and on top of that, trying to see our patients, we're in the middle of it. We're in the mouth.
Yeah,
So
yeah.
you have to change between seeing patients and if you have an emergency, making sure you leave everything that you used for this patient here and go suit up for the other patient. It's just very time consuming, very draining. And one of my concerns with my office when we started doing these sort of things was that because we were seeing less patients a day, that means less income was being drawn in. And how do you balance that? Because patients, obviously, you can't just charge them more for the same procedure because of COVID. So, you look for grants and things that the county was offering as far as PPEs because, we're seeing less patients and we're needing more supplies. So it was that kind of stress where you had all these kind of questions going on and, I've never had to take temperature or anything like that prior to bringing a patient back.
Right.
And now I'm like, oh, I'm a nurse now? On top of being a dental assistant. So just doing a lot of different things. But now it flows nicer. I'm more used to it. I move quicker, so we're able to see a couple more patients. So it's working out pretty well. We've my doctor brought in air purifiers and air vacuums and updated our suction machine, our vacuum machines. So it's, we've done a couple of other improvements, to assist with this pandemic.
I think one phrase that I've heard a lot is you're building the plane and flying it as well at the same time. Yeah. That's what it feels like.
Pretty much. Yeah. Those first 2 to 3 months were really tough.
Yeah.
It was exhausting. I mean, it was hard. It's better now, but then you hear the numbers going up, and you also see the lacks in some people that because they're already used to doing the same routine, they sometimes kind of not doing their part. So you want to be careful with the fact that the pandemic is still here. It hasn't gone away. There is no real end in the near future, so we have to all do our part so that we also maintain that stress level as low as possible.
Yeah, I fear some people have become quite complacent, but I think it's the efforts that, people at your jobs, I mean, you guys are essential in everything. You're medically very, very important to everyone. And so to hear that you guys are making these strides to make sure that everything still flows, for the most part, business as usual, is reassuring.
Exactly. Exactly.
So my follow-up question is, I suppose while we're talking about physical, emotional, and mental health that goes into dentistry, there was a medical journal published by Dr. Steve Keisley, I believe is how you pronounce his name, and he says, quote, left untreated, dental diseases can lead to teeth loss, such as that with people severe mental illnesses have 2.7 times the likelihood of losing all their teeth compared to the general population. And so could you sort of expand on what all that means when someone is they're having a hard time taking care of themselves, what kind of suffers as a result?
Well, yeah, and, it's kind of like we were saying earlier, you'll have patients that because of either trauma they've had before and the fear, anxiety of not being able to be in control of something that's being done to them, while they're still awake or something, you're in the patient's mouth, and the fear of pain makes them not want to come in or prolongs them from coming in. You have the other issue of finances. And because of finances, people sometimes will opt to just remove the teeth versus trying to restore them. So you have that as well. So the worst part is having a patient who has pain and infection and just continuously every so often taking pain medication or anti-inflammatories or maybe an antibiotic here or there, but not, they're just removed, they're just kind of subsidizing that symptom versus really getting to cure the problem. What can we do to actually stop this infection? And if this infection continues to grow, it could be something where it can cause death. Infection can grow in the neck, in the head, and become where it's so severe that you end up in the emergency room. I just know of a patient who happened, that just happened to them, because of the pandemic, and they were having this pain, this infection. They didn't go into the dental office and is now being treated at an emergency room at a hospital because of this huge infection. And just to point out, not all infections are painful. There are people who are walking around with dental infections and they don't know. And unless they get an x-ray, will we be able to see it? We've had patients before that we've taken an x-ray because it looks suspicious or something like that to our eyes, or taking their check x-rays that we call them sometimes, and we see something that doesn't look right and ends up being that the patient had an infection. It's like, well, how? I didn't feel anything. And it's been there. So, having said that, not following through with your dental health care, you will come across with severe infection, and if left untreated, I mean, it could be something where it could cause death, besides just the loss in teeth, which is, function as you get older. I mean, food becomes more appeasing. And what do you need to eat is your teeth.
Your teeth. So, physically, this takes a toll, and that's something that's quite, it's almost fascinating in the scary sense at how, if left untreated, these problems can really prolong for people. And so, like you said, mentally, you mentioned the aspect of sometimes people are scared to come in, and that added pressure of, not pressure, I suppose, but this anxiety, I guess, of going in, it really starts to affect people.
Yes.
So how do you handle a patient who has had a harder time mentally sort of trying to adjust to whatever procedures they might go through? You know what I mean? Does that make sense?
Yes. So if you have a patient that's just suffering from anxiety and fear, you kind of have to, everybody's individual. So some people do like to ask questions, and the more that you answer them, the more they feel like, okay, you kind of walk them through the procedure. Okay. Some patients don't want to hear what's going on. So you got to feel the patient and see, treat them like an individual. Not everybody is textbook. Some people need more explanation. Some people need less. You kind of just have to go that route. And I think as a professional, I've come across, some patients that are more difficult than others. And I just try to say, it's not me. They just don't want to be here. Who wants to be in a dental office, But I always say, if you're having pain, if you're having discomfort, if you're having an issue, where do you go? You're coming to us. You're coming to us to seek that help, to seek that alleviation of pain that you're looking for. And that's where we come in. So we are actually heroes.
Yeah. Actually.
Well, heroes wear capes, but we wear gowns now.
Oh. Someone should put that on a shirt. They should put that on a shirt. Oh my gosh. So, my final question, which I suppose is my favorite question because it pertains to our identity, is that according to the U.S. Health Workforce Chart book on clinicians, only 15.2% of all female dental hygienists and dental assistants are Latina. So how, if at all, does this impact dental care, or how does this racial disparity, like, does it impact anything, or any insight that you might have to that statistic?
I can't really comment on the statistics of it because I don't know that much in depth in it. But I will say this. I do teach a dental assisting class, and I've met many other dental assistants, and I don't know where this percentage comes from because it seems very low, or maybe it's because of the area that I'm at. But I feel that our profession is very diversified. I think, if anything, what I do see is the lack of men. When I'm teaching a class, most of my class are composed of African American, Latino, Ethiopian, African. I do have Caucasians, but it's so diversified that I don't know where that specific statistic comes from.
Yeah.
Because I've never felt where Latinas are a minority within my profession, within dental assisting profession. Maybe it could be my area of where I am. This area is very diversified, so I've never felt that way. But I do see a lack of men in our profession as far as dental assistants. I think our classes are about 10 weeks. Every 10 weeks, I probably will see a male come in every 30 weeks.
Wow.
So maybe within a year long, I'll see maybe 3 or 4 male dental assistants in our classes. As well as sometimes we ask temps to come into our dental office. And again, as far as hygienists and dental assistants, don't see many males in our profession as far as that. But I do see it's very diversified in race.
Yeah.
That I do see. Now, what I do find is a lack of knowledge and education when it comes to our profession. So a lot of our Latinos, or Latinas rather, lack that education and are just getting training within the dental offices. And because they're getting trained in dental offices and they don't have an actual certification and book knowledge, their knowledge of our field, their salary and wages come from being up here to coming down. And I feel that sometimes it's taken advantage of that work. Whereas that, you're dealing with healthcare, yet you want to compensate your employee that's dealing with patient care and health and want to pay them less than an employee at McDonald's or Target. And don't get me wrong, those are obviously hardworking professions too, dealing with customer service and everything. But here you are dealing with healthcare, and because this person has not gotten the proper education, they are, I feel like the wages or salary does not come up to where it really they're really owed for the work that you're providing, for the service that you are providing.
It's almost astounding that we still see these disparities in like the wages and these figures that you guys are receiving, or perhaps just some of your students, perhaps, and it's disheartening because, again, where we live is the county that we live in specifically it's not the cheapest one, and
exactly. I have students that always ask me, well, how much should I be making? I said, if you're coming to school, if you're getting trained at a dental office, I cannot say because I don't know your skill and your knowledge. It's kind of hard to tell you. But if you are coming to class, and that's the same thing, it goes for any education, which I've been reading articles on that too, as far as college education. Then you have students like yourself, or students who have already graduated, like one of my daughters, that have gotten degrees and certifications and have put in all this work and come out into the real world, and you're not being compensated for that. And that is really hard, because here you are putting all this work. I tell my students, you're putting all this work, all this knowledge to really go in there and give your patients the best care possible, and you're not going to get compensated for it. That's not fair. It's not right. If you're getting that education, that knowledge, you should not be making the same thing you could be making at a job where you need absolutely no experience and just work a register, or or just something that you don't need nothing but experience for.
Yeah.
So why put yourself through all this stress and workload and using all this brain power if you're not gonna be able to pay your debts later.
And that's exactly why transparency is so important, and we have these conversations as women working in these careers, not just jobs. And that's why it's so important to have this diversified field, especially composed of women. And yeah, I really respect that you talk to your students about that, because you might be the first person to tell them you deserve to be being compensated fairly.
Always. It's, think of real estate. If you are putting all this work into all these homes in this neighborhood, you want to be able to rise up, and that, appraised value of that neighborhood should rise with it, And I think being a minority, being a Latina, which I don't know how much of a minority we're going to be soon, but I feel that we need to uplift and encourage one another, being women, being a women of color, to bring out the best in each other, and support each other and push each other to be better, because that is the only way that we can all come up in value. Okay.
And on that note, that's why it was so perfect to talk to you, a woman who is a professional, a woman who is Latina. I look up to you an overwhelming amount, and I heavily appreciate you talking to me today. I really appreciate it. My second interview, I will be interviewing Julius Richmond, who is a close friend of mine. He is a nursing student, and he is going to answer some of the questions I have for him today. So, Julius, could you introduce yourself?
Hi, my name is Julius Richmond. I'm a nursing student at Montgomery College in Montgomery County, Maryland.
So my first question is, what kind of nurse are you looking to become? Because I know that your mom's an RN, so do you have any, in an oncology field specifically, but do you have any different kinds of aspirations? What's the goal?
Well, yeah, like you said, I want to try oncology, but another thing I want to try is pediatrics, because obviously I just like working with kids. They're really fun. But I don't know. I think it's not too set in stone. I'll be willing to do anything. I think the one thing is I'll just once I go through school, I'll see what happens, and whatever I feel like is most interesting or most important to me is probably the way I'll go.
Cool. I like this. You have what's the word? Varying interests. You don't mind. You're not too set in stone in anything particular. Just lots of interests. Cool.
Willing to do anything.
And so my next question is, what does a day of a nursing student look like? So what kind of classes are you taking? Are you required to take, or most excited to take, or anything like that?
Well, the classes I have to take, a lot of them, besides the prerequisites, the ones that everyone has to take, it's mostly anatomy, a lot of anatomy, and biology. And those classes are pretty hard. It was hard for me to get used to them, because before college, I had never really experienced a class like that. And anatomy, especially now, is probably one of the hardest classes I've had. But I think it's obviously important, and everyone has to know it to be able to go in the field. So, and I
Okay. So what does a day? No, it's fine. What does a day look like for you? Like, how many hours a day do you spend studying, or like how many classes do you have to take throughout the week and stuff?
Well, it's for everyone, especially at my school. But right now I'm just in anatomy 2 because it's my last class before I can start doing the nursing classes. So usually the goal is to study at least like 2 hours a day, especially when it gets closer to exams. A lot of memorization. It's pretty brutal sometimes, but I don't know, I feel like especially once you get used to it, it comes a lot easier.
Mm-hmm. So would you say the most challenging part of studying in the field so far is the difficulty of the classes, like you said, like anatomy, and because it's a lot of memorization, like that's the hardest part?
Yeah, and like I think one thing that is specifically difficult for me is a lot of the lecture stuff, because like when we're doing labs, it's a lot of labeling and we can see everything we're doing. But when it comes to the lecture, a lot of it is like we're talking about cells and like a bunch of stuff, like microscopic stuff, and a lot of that is hard for me because, you know, I can't see it, and like I'm a visual learner, and that was very difficult for me.
Mm-hmm.
So I really had to like figure out how to study best and like what works best, what doesn't work. A lot of trial and error, especially at the beginning.
Yeah. Well, I think you're doing. I hope you're doing just fine. Considering next semester, you said you're going to be starting like your actual nursing type classes and stuff, right?
Yeah, probably in the fall.
Oh,
I think once this semester ends, be applying for a nursing assistant job and working. But I can't. They don't let you apply to the full nursing program while it's the spring semester. You can only do that in the fall.
Oh, okay.
Which kind of sucks, but it's alright. I'll be able to work in a hospital for a couple months and get my feet wet, I guess.
Oh, that's exciting. It's like for you to finally be in a hospital and everything. So my follow-up question to that is a statistic provided by my textbook, Barkan, Chapter 9. 83% of RNs are white. What can be done to ensure that medicine can become a more diversified field? Is that something you guys ever talk about?
It's something we've touched on. I feel like we haven't talked about it enough.
Mm-hmm.
If I'm being brutally honest, I think it's really important to make sure that a nursing education is affordable. Especially a lot of private universities are where people go to get their nursing education, and that's good, but like it's very expensive, and a lot of people might not be able to get scholarships, and they might not be able to get loans. So I think it's important, especially for a lot of community colleges, to get like a pretty good nursing program like the school I'm going to. It's one of the best community college nursing programs that I'm aware of, and it's still expensive, but it's a lot more affordable than a private university. And one other thing is, I think it's important to like, I don't know, because when I started my education, I wasn't sure if I could do it, so I think it's important to, like, to explain to a lot of younger people looking to go into college that anyone can do it. Like, people can go through nursing school, anyone can do it. Like, my mom did it when she was, like, pregnant, and, you know, I think it's really important to just make sure that you give a fair opportunity to everyone. And I think that it should be a more diverse field, especially these days. You know, like you said, 83% of RNs are white, and I think that is an issue.
Mm-hmm.
And it's really important to make sure that a lot of younger kids are interested in the field, and we have to make sure that we emphasize that anyone can do it.
Mm-hmm. Yeah, absolutely. I think one big asset that you mentioned right away is making it accessible, and so in terms of cost, and so it's good that we have such a like Montgomery County or Montgomery College that offers the nursing program, and like you said, it's expensive, but it's on the more affordable end of expensive. So there is a privilege in having healthcare, of course, and according to the Kaiser Foundation, most uninsured people have at least one worker in the family, and people of color are at higher risk of being uninsured than non-Hispanic white people. So as someone studying medicine, do you guys talk about how expensive the cost of healthcare is? Like, do you have to take an ethics class where you guys talk about that, or do you expect to talk about that, and how do you sort of, I guess, address those who are uninsured?
Well, the first thing we talked about in my nursing assistant class was ethics, but I don't think we've touched enough on, like, people who are uninsured and, like, how we can help them and what is, like, the best way to make sure they're healthy. And maybe once I get towards the higher level classes, we'll touch on it more. But I think especially in the CNA class, there has to be, I feel like there could be a whole unit on it, you know? But I think once I start working, I'm definitely going to have to, like, see what's the best way to help people who might not have insurance or, like, things like that, you know?
Mm-hmm.
But I definitely feel like we have not touched on that enough as of yet.
Mm-hmm. And is it difficult, as a student who believes that, I mean, you believe everybody should have health care, right?
Yeah.
Yeah.
Of course.
I just wanted to make sure.
The fact that it's a privilege is kind of messed up. I feel like it's a right, but
Mm-hmm. And so, like, the fact that we don't have that kind of system here, and you're going in to be a nurse, and I assume you want to help as many people as possible, but for whatever reason, we just haven't adopted that system yet.
Yeah, it's like, it feels like the system is very selective. Like, it excludes people, and that's not the best way to do it, you know?
Mm-hmm.
Especially, like, a lot of people from lower income families, if they, like, get into a bad accident or anything, like, you know, anything could happen. And, like, if they get into a really bad accident, like I just said, it could really, like, mess them up. So I feel like that stuff should be a right. It shouldn't be a privilege, as you said.
Yeah, no, it shouldn't be really up for debate. It shouldn't really, yeah.
Yeah.
And I think, just one last thing, I'd be remiss if we didn't mention the fact that we live in Montgomery County. And so for one, on the one end, it's super diverse and we have a large population of immigrants, but also it's really expensive. And I have to add that some of those immigrants perhaps may be undocumented, and so they don't exactly have that kind of health care. And so being where it is that we live and where you're studying, I think it's important that we sort of recognize the kind of disparity and everything, because there are people in Montgomery County who they're our neighbors, on one hand, people can afford higher levels of healthcare, and then there are people who can't. So, yeah, but I praise you for believing in that you think it's a right and everything, and so I hope in our lifetime that we see healthcare becoming something that people are just born with,
Yeah, it should be accessible to everyone,
Mm-hmm.
because everyone in their life is going to have some health problems. It's inevitable, and so the fact that people have to literally give everything they have sometimes just to make sure they're healthy is not how it should be.
Mm-hmm. That was well said. So, thanks, Julius.
Mm-hmm.